Some surgeries remove disease. Some surgeries relieve pain. But every once in a while, we get a chance to change someone's life. This young man was born with a cleft lip and palate. Although his lip and palate had been repaired as a child, one major problem remained. He was missing part of the bone that supports the upper teeth. Two of his front teeth never erupted. Instead, they became trapped deep inside the upper jaw. He had to live with a large gap in his smile for nearly 20 years. He was embarrassed to smile. Today, we're going to show you how an entire team worked together to give this patient something that most of us take for granted, the confidence to smile. I'm Dr. Tom Bolton. Welcome to the Open Reduction. This patient was 19 years old when he came to see me. He had already undergone multiple procedures throughout childhood. His cleft lip had been repaired as an infant. His palate had been repaired shortly after. Those procedures were extremely successful, but he was still left with a large alveolar cleft. Because this bone never truly developed, teeth 9 and 10 were not able to erupt into the arch appropriately. Instead, they remained impacted within the cleft. The missing teeth created a large gap in the middle of his smile. This, understandably, made him very self-conscious. Our goal was never simply to replace the teeth. The goal was to give him the optimal cosmetic and functional result to smile confidently. The first step was removing the impacted teeth. Because these teeth were positioned deep inside the cleft, careful surgical exposure was necessary. Once these teeth were removed, I allowed several months of healing time before reconstruction. One question I know people are going to ask is why not just simply bone graft the cleft? When it comes to congenital alveolar clefts, grafting is not a predictable option. The cleft lacks the blood supply and normal anatomic structures to support a large graft in the long term. Instead, our treatment plan focused on a stable implant-supported prosthetic. I waited 4 months and then reevaluated. Tooth number 8 had served him well for years, but it had significant bone loss and a poor long-term prognosis. The cone beam CT demonstrated there is enough bone at the number 11 site to place an implant. I treatment planned this case with the prosthodontist, and we both decided the best course of action was to remove tooth number 8 and place 2 implants, one immediate implant at site number 8 and 1 implant at site number 11. The implants were buried beneath the gum tissue for 4 months. This protected them and allowed them to heal with the bone in a process called osseointegration. I uncovered the implants 4 months later. Both healed beautifully. I placed healing abutments. At this point, the surgical portion of the treatment is complete. But restoring a smile is never accomplished by surgery alone. This is where an outstanding prosthodontist becomes essential. The prosthodontist designed a restoration that not only replaced the missing teeth, but also the missing gum tissue created by the cleft defect. The result is something that looks both beautiful and natural, functions well, and gives this young man the confidence he has been missing for years. Cases like this remind us that medicine is a team sport. The best outcomes happen when surgeons, restorative dentists, orthodontists, and dental laboratories come together to give the best results. This is why I do what I do. This young man hid his smile for nearly 20 years. Now he smiles proudly. This makes every step of the journey worthwhile. If you enjoyed this patient's journey, please subscribe to my channel where I share real surgical cases, explain the science behind them, and show how oral and maxillofacial surgery changes lives. Also, if you're a professional, check out my website, theopenreduction.com, where you will find advanced CE topics and courses. I'm Dr. Tom Bolton. I'll see you at the next case.